Yeah. Well, let's bring in Dr. Dave Montgomery, a board-certified cardiologist, generalist, and host of the Good Doctor TV. Good to have you with us once again. You know, that moment on the Golden Globes red carpet, she appeared to be a little off balance, a little shaky while doing those interviews. Was that a warning sign?
Yeah, good morning to you. I wish it were under different circumstances. When you look back at it, you kind of wonder, was she experiencing some of the typical signs and symptoms of heart disease? And I can't say just from the way she appeared that that's what it was. She had been very public over the last 4 years, about her battles with opioids and things like that. And we think that she has, was in recovery. We do know that, genetics plays a big role in heart disease. Dad had a heart attack and heart failure and died very, very early. And, could she have had some of those genes that caused that? I mean, there's a number of things that can play together. And I think we should respect what Priscilla said, and that is to give them some privacy before we speculate too much.
Well, we don't know the cause, exact cause of this cardiac arrest. She was only 54. You mentioned the addiction. But in terms of her family history of heart disease, I mean, Elvis had heart trouble. Both of his parents died of heart attacks. So how likely is it that you will experience a heart attack if you have your parents and your grandparents with the same issue?
Yeah, Adrienne, great point. It is a big factor in your own medical history, your parents' history. And so because we don't know all of the details of Elvis Presley's heart condition, we can speculate that you will get some of those genes from your parents if it was in fact genetic. Cholesterol, for example. I tell my women around this phase of age that although you're young and you're healthy, this is also a time when your body is naturally changing. So we call it menopause, when the hormonal environment changes, things like cholesterol, blood pressure, blood sugar, all of those things change without you changing anything else. We've got to bring this into our consideration when it comes to this. And we know from the national data that women in this age range, the risk of heart disease is actually going up while older women's risk is going down.
Yeah, and again, for anyone, male or female, you think about Elvis dying of a heart attack because of prolonged drug use. You think about Lisa Marie, cardiac arrest, admitted drug use. And then, of course, it's been in the news with Damar Hamlin having a cardiac arrest on the field. Totally different cause, totally different circumstances. But it seems as though, is it just me or is it in the news more often? Are we seeing more people with heart failure? Are these numbers going up?
Yeah, I mean, you make the point, right? Which is the group between, 35 and 54 across the board, but certainly in women, the incidence of heart attacks and heart failure is going up. And so we see that. And there are a number of reasons for that. And I think, although to your point, the reason for Hamlin's cardiac arrest is very different. We know that things like heart disease from genetics, like a blocked artery that was caused by cholesterol, or opioids, or a combination of the two, can literally cause a heart in that sensitive period that we were looking at last week in the EKG that causes the heart to beat. It can cause a chaotic heart rhythm, and one can sustain a cardiac arrest. And so I think, right now what we should be doing is just wrapping our arms around the family and giving our thoughts and prayers at this point.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.